Okay, now I want to spend a little bit of time talking about our response to the governor's orders. And no doubt you guys are getting pretty tired of this, right? Anybody else getting tired of this? Social distancing and wearing masks and all of that. Yeah, I know all about it. I know what you mean. All right? Now, one of the good things is it seems like we're starting to get some good news about vaccines. I've heard about 3 of them that promise to be very effective. Of course, we don't know ultimately and how quickly they'll be able to get them distributed and all of that. But it seems like there's some good news, and it seems like there's some light at the end of the tunnel. But the truth of the matter is for most of us, it's still going to go on for probably a few more months. And I know that you're getting tired of it, but we're just going to have to buckle down, and we're going to have to deal with it for a little bit longer. Now, it's been a while, like I said, that we've talked about it as a church. And so last week, after the governor's press conference, I thought it would be good for us to sit down and just to talk about it a little bit and how we should handle it as a church and how we're handling it as leadership and sort of the structure of the church. And so Thursday, I spent almost the entire day pouring through data. Rewatching the governor's press conference, looking at the Minnesota Department of Health website, the website for the CDC, a number of other news stories and things like that, because I want how we move forward with this to be driven by data, by reality. All right, and so we did that. I did that, put something together for the board, and on Thursday night, our entire board meeting was dedicated to talking about, all right, so what do we do here? Because I know that there are some other churches that are going to online-only services, and so is that something that we need to do? Are there certain things that we ought not to do? Are there other protocols that we should be doing? And so I wanted to kind of talk through that process with you. And so the first thing I want to do is I want to talk about some of the data that we looked at that informed our decision, okay? And I've got just a few bullets here, okay? Now, you've probably seen that cases have been growing rapidly, that when it comes to pandemics, that there can be an exponential growth of it, which means that, it's not linear, it's not just, 5, then 10, then 15, but it's 5, 10, 25, 50, like that. And so it grows really fast, and it seems like for a minute we had that happen. And it's kind of leveled off a little bit the last couple of days, but the numbers are still too high for us to be complacent. And actually for months, we've actually been able to keep the cases pretty low by following the protocols that we've been doing, by masking, by social distancing, by limiting our exposure, and all of that. But what you've seen over the last couple of months is that as things have started to open up, the numbers have started to rise again. And in fact, I think there have been a lot of people who have sort of become complacent or just gotten tired of taking the measures that we've been taking, and I completely understand that. But then what we've seen then is the numbers have started to increase. And actually contributing to that is the fact that as the temperatures go down, we start to go inside, and you're more likely to spread it inside than you are outside. And so, that's contributed to the increases as well. And what we're seeing is that hospital beds are starting to get to capacity, but one of the things that the governor said is not only that, but our healthcare workers are getting sick. And the governor says that the healthcare workers are getting sick not primarily from going into the hospital and treating patients, but from community spread. And so they're actually going out into the community, they're getting sick, and then they're not available to help care for people. So even if we do have enough hospital beds, we don't have enough workers to be able to staff the hospitals. And if the numbers continued in the direction that they were, then that would start to become a dire need. And so that's one of the main considerations for that the governor has made when he started to lock things down a little bit. Now, one of the great things is that we know a lot more about COVID today than what we did back in March or April. And so when he locked down the whole state basically, or had the shelter-in-place order, we don't have to do that kind of thing again because we know where the spread is most likely to happen. And so he can have more targeted approaches to shutting things down. Now, for a lot of people, that's still not good. For bars and restaurants and things like that, that makes it really, really difficult. But we have to do something to curb the spread of COVID before it becomes an absolute dire situation. Now, what's difficult is that, and this is some of the data that we looked at, is that younger people tend to not be symptomatic. They tend to be asymptomatic, but they can spread it just as much as anyone else. And so, of course, if you're not feeling symptoms, then you don't feel like you're contagious. So, if you're not feeling symptoms, then you have a tendency to be a little bit more careless, and then you start to become an even greater spreader. And so if you don't have symptoms, you tend to not take those measures quite as seriously. One of the other things that we saw is that children under the age of 12 very rarely exhibit symptoms of COVID, and they actually don't spread it very much either. And they can't really figure out why, but the spread tends to be less in children than what it is, even with teenagers and adults. And so they published a list of places that are the greatest risk of the spread of COVID, and they were like bars and restaurants. They were weddings, and I assume that's weddings with receptions where people are eating, where they have to take their mask off. People are together for long periods of time, extended exposure to each other. Sports, gyms, social gatherings, and he talked about even just something as simple as having friends over, where you kind of let your guard down a little bit, that there's a lot of spread happening there. And one of the things that we saw is that worship services are actually pretty far down on the list. Which is why, part of that is why he didn't close down or put further restrictions on worship services, because they tend, as long as you're following the protocol, as long as you're masking, as long as you're distancing, they tend not to spread as much as some of these other events do. All right, so those are some of the data that we looked at, and so I want to add one little other bit of information to help us to help you kind of see why we're doing what we're doing. And it's this, is that as I talk to many of you, and many of you actually who are not here but are watching on the live stream because you've been staying home, many of you are tired. You're tired of this. And there are some people who are really struggling. With loneliness, you're struggling emotionally, you're struggling relationally, you're not able to see the people that you want to see, and that matters, okay? COVID is a real thing, and I think it's a threat, and I think we need to take it seriously. And I think we also ought to take seriously the fact that there might not be a more important time for us to be the church. The church is the church during times of struggle. And so that means that as a church, even though we want to be safe, even though we want to take COVID seriously, we also have to make sure that we are ministering to one another and also being good neighbors to the people around us. Okay? And so now is not the time to stop being the church. Now is the time to really lean in to being the church and to caring for each other. Okay? These would be really easy decisions to make if we didn't have to deal with kind of those two tensions that we have, the seriousness of COVID, but also the seriousness of the loneliness and the sort of spiritual malaise that people are feeling right now. And so we have to take all of those things into consideration when we're trying to decide what to do. And so with this in mind, the board met on Thursday, and here's what we're going to do. Okay? We are not going to go to online-only services. We're going to continue to meet in person. And we're going to continue to social distance. We're going to continue to mask. And in fact, we're going to ask you to be even more diligent. As the numbers go up and the likelihood of spread is even greater, we're going to ask you to be more diligent, not just in how you behave while you're in the church building, but how you behave at home. Okay, in the patterns that you have, to keep your circle small, as the governor has said, and also to keep an eye especially on vulnerable people in your life. Okay, and it's terrible. I know the idea of not spending Thanksgiving with your family just is not very appealing at all. Okay, but you also have to keep in mind the vulnerable people in your life, and we want to make sure that they are safe. Okay, so we're going to continue to follow all the protocols that we have been. We're going to be masking, distancing, hand washing, sanitizing surfaces, all of the things that we've been doing that have proven to keep the cases low, and we're going to continue to do that. Okay. It's especially important for you, and I've already hit on this a little bit, that as the numbers increase, that you do your due diligence to be thoughtful about how you interact with people right now. All right? And again, both worship service, inside the church and outside the church, because what you do out there matters. All right? So keep your circle of contact small. And I'm going to talk especially to youth and young adults, okay? Because what we're seeing is that youth and young adults up to about the age of 35 or so tend to be the largest spreaders of COVID, okay? This especially applies to you. All right, and I know you guys tend to be really, really social, and we have a great group that's in that age group, and you guys love to hang out together and all of that. And I just want to say, just be really diligent about following all of these things. And I'm not asking you never to leave your house or anything like that, but just make sure that you're being wise about how you interact, okay? And again, I know this is hard, but Thanksgiving, there's some instructions from the government about Thanksgiving, and you're just going to have to determine that for yourself. But you know, the recommendation is that you don't have more than 1 or 2 households together on Thanksgiving, and I'll just let you decide from there, but that's the recommendation. If you're sick, stay home, okay? If you are vulnerable and you're feeling anxious about it, then stay home. We have a good online experience, and we would love to have you join us that way. And hopefully this is something that's only temporary. Hopefully it's something that's actually fairly short-lived. But for the time being, especially as the numbers increase, make sure that you're taking care of yourself. Whether small groups meet in person or by Zoom is up to the groups. We will encourage you to meet digitally if you can. But again, I know that this is especially a time when people are feeling lonely and they're feeling, you know, this sort of spiritual hurt. And so we need each other. All right? And so make sure that you're staying in contact with each other. And so you're going to have to navigate that tension again between caring well for each other and also making sure that we stay safe and we get through this smoothly. And so we're going to leave it up to you as small groups how you do it. But just make sure that you're considering how everyone is feeling. Some of you might do a hybrid group or something like that. I encourage online as much as you can, but we will leave that for you. We're going to continue Sunday morning kids ministry. And again, that's because we just don't see a lot of evidence of spread among kids, and some of this will depend on how healthy our volunteers stay, and you know, all of this is subject to be revisited over time, but we're going to try to continue to meet because we think that the risk is pretty minimal, and like I said, we'll continue to reevaluate over time. We are going to suspend youth group at least for the next few weeks, again, because of the data, because teenagers tend to be asymptomatic, and they spread just as much as adults, that we're going to dial back on that a little bit for the time being, and hopefully there will be a time when we can restart it. And then finally, we're going to make sure that as a church that we communicate well. In other words, if there are some of you, if at some point you test positive for COVID, we want you to let us know in the office, okay? And we're not going to send out an email and let everybody know that Al Eggert tested positive for COVID, okay? But what we will do is we'll try to figure out, all right, was there someone that you were in close contact with while you were at worship service? And we'll contact them and we'll say, hey, we just want to let you know that you might have been exposed to COVID, and so if you want to go and get tested or if you start to see symptoms, just make sure you're taking it seriously and all of that. We're not going to publish names or anything like that, but we just want to make sure that we have our lines of communication open so we can stop spread as much as we can. And we actually had a case of that where someone in the sound booth was exposed to someone with COVID, and they were exposed then to other people in the sound booth, and we just made sure that we communicated that, and then people were able to take the appropriate measures. They quarantined for a few days, and everything worked out okay. All right, and so we're going to make sure that we do that, but we need your cooperation with that. If you test positive, just let us know. Shoot us an email and just let us know, and we'll figure out how to deal with that. Okay, we're not gonna ostracize you or anything, but probably do hope that you quarantine when you do. So, all right. Now let me end with this. Okay, do not be afraid. You know, we're coming into this Advent season, and there are a lot of angels that show up on the scene, right? And the first thing they always say is, do not be afraid. Okay, and so that's what I want to say to you. Don't be afraid. Certainly COVID is something that we want to take seriously, right? All around the world, it's turned the whole world upside down. And so I'm not going to say it's no big deal, okay? But don't give in to despair. We worship a big God. We worship a God who created the universe. And coronavirus is not too big for him to be able to handle. And you're not too small for him to care about. Okay, and I want to encourage you with a passage of Scripture that we looked at. It seems like a long time ago, but it was actually just a few short weeks ago from Philippians chapter 4. Maybe you remember. We actually tried to memorize it during soul training. Philippians chapter 4, where Paul writes this. And remember, he writes this from prison on death row. He says, "Rejoice in the Lord always. I will say it again, rejoice. Let your gentleness be evident to all. The Lord is near. Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. Finally, brothers and sisters, whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent or praiseworthy, think about such things." Okay? Be mentally and spiritually disciplined during this time. Don't dwell on the negative. Control what you can control. And trust God with the rest. And make sure that you're taking the time to reach out to your brothers and sisters in Christ and make sure that they're doing okay. Even if it's just shooting them a text or a phone call or an email, just saying, "Hey, I was thinking about you today, praying for you. Just wanted to make sure that you're doing okay." And I think if we do those things, I think we'll come through this just great. Okay, so I hope that this is an encouragement for you. Take it seriously, but don't be afraid.